Hi, my name is Dana and my channel is Fabulous Style. Usually I make thrift haul videos, but today I want to make a video about how I prepared for a hospital visit. I've kind of learned some things about how to prepare for a hospital visit. I watched other YouTube videos and I found some really helpful suggestions. And so first I'm going to go through like what I took with me to the hospital, what I think are essentials if you're going to be going into for a hospital stay. And then after I'm done with that, then I'll talk about a little bit about the different surgeries that I had, and if you're interested, So anyway, for the hospital stay, both of my hospital stays, I was scheduled to stay in the hospital either 1 or 2 nights. So I wasn't planning on being there for a really long time. But nonetheless, I mean, if you're there for a day or 3 or 4 days, you're going to want the same kind of stuff. After I had surgery, when I got back to my room, I was extremely groggy, and the light, any light in the room just like killed my eyes, and I just wanted to sleep. That's all I wanted to do. Plus my mouth was so incredibly dry. So I was glad that I knew about that beforehand. And I think one of the most important or most essential things, so glad I knew ahead of time to bring this, and I actually have more than one that I brought just in case, was an eye mask. Because even when the room is dark, there's still blinking lights, and I just have a hard time falling asleep if there's a light somewhere in the room. And the hospital that I was at, they have a beautiful view from almost all the rooms, and there's a shade that comes down that keeps out the sunlight, but it still lets in brightness. And when you're in the hospital, they come in every 2 hours and they wake you up and take your vitals and, check to see if you need pain medication and stuff like that. So you don't get a restful sleep. And so for me, this was the best and most important thing to have at the hospital, was to be able to put this over my eyes and just shut out everything. I did bring a pair of earplugs. That was one thing that I had read or something, because some hospitals are really noisy. The hospital I was in, they would always shut my door. They gave me the option of having my door shut. So I didn't have a problem with there being too much noise, but that's definitely something that you should take. I did have some earplugs in my bag. This is the size bag that I took to the hospital. I took in here a change of clothes. The first time I took like a short sleeve kind of a robe type thing, but I ended up not using that because when I had the IV, it just didn't really make any sense to try to put my arm in a robe, because then it would have to go up through the IV and then or through the robe and then come out. And I don't know. I hate IVs. I hate them. And they always hurt my hand no matter what. No matter where they put it, it just aches in my hand. So at the hospital I was at, when I would get up out of bed, they would always take another hospital gown, and put it on around the outside of me, and then, snap it so that it stayed on and it covered up your back. So you didn't have to worry about that when you're walking, when they get you up to walk around. So anyway, the eye mask was an essential. The other thing, and I guess both surgeries that I had entailed incisions in my abdomen. But either way, I would still, no matter, anytime I went to the hospital, I would take a little pillow like this. This is actually a doll, a pillow for a doll bed that I made years ago for a porcelain doll that my sister-in-law gave me. But this was the perfect size. This last time, I just kept this on my stomach the whole time, on my incision, like when I would cough or anything, you know, you want something to press on your abdomen or wherever your incision is. But the time before, because my hand, having the IV in my hand just really irritated my hand. So I kept my hand up on the pillow, just laying next to me. And that seemed to really relieve that. So having this pillow was a really great thing to have at the hospital. Another thing that I had found before I went in for my first hospital stay, I found it at a thrift store, but it's one of the bags that they give to people in first class on an airplane. And so it was already full of some things, and some of the stuff I threw away. Everything that was in here was in, you know, a little cellophane packaging, so nothing had been used. But I like this because it has this little hook on it, so you can just take this into the bathroom with you in the hospital, and it's got all your stuff in here. But I added some things, and then some of the stuff I used what was already in here. But it would be easy enough just to, you know, use one of these little travel cases and make up your own. What I have in here is, this is like one of those little toothbrushes, and then I put in some toothpaste. The hospital did have this, but just in case, I wanted to make sure I had my own. I also brought a little mirror because when you're laying in bed, you know, it was nice to be able to see myself and see if I had, you know, mascara under my eyes or whatnot. So having a little compact mirror was very nice. Instead of like a big thing of moisturizer, although I do think I have lotion in here, I just packed in a little thing of eye cream. So I wasn't sure if my skin would feel dry or not. I do have another eye mask in here that came with this set. And then one of the most important things, this is one of the essentials, is lip balm. Because after you have anesthesia, when you get, I don't know, at least for me, my mouth, my throat, everything was so dry, and my lips were so dry. So I was constantly putting on lip balm. This is Burt's Bees. The wrapper came off of it. But that was very important to me to have. I had brought a hair tie, but laying in bed, I don't think I ended up using this at all. But if you have long hair and you're going to wash your face, or if you just want to, I guess you could kind of put a ponytail to the side and because your hair is always everywhere. And then some waterproof mascara. This was nice to have because I didn't want to put on like full makeup, but I wanted some mascara and the eye cream and stuff. So that's what's in one side of this little case. And then on the other side, I mentioned earplugs. So those, I'll keep these in here, but I would definitely bring them if you're planning on going to the hospital, because you never know. This came in this little thing. It's a travel comb and brush. So that was very, whoops, it comes apart. That was nice to have, so I could comb my hair and stuff. It also came with a little thing of tissues. There at the hospital, they had a little box of tissues that was just on the table that they have. This is hand and body lotion, like to put on your hands if your hands are dry when you're laying there in bed. And then I also had brought just a small package of cleansing cloths, facial cleansing towelettes. And it was really nice to be able to use these. I think the first day I never got out of bed. So it was nice to be able to, you know, wash my face and then put a little moisturizer on, and then in the morning do the same thing, kind of wash your face down and put on a little mascara. It made such a big difference, just to be able to feel like, you know, you're not covered in oil and whatnot. Plus, I don't know, it just seems like you feel dry. I felt dry and oily at the same time in the hospital. So until I could get out of bed, and it was nice to be able to have those cleansing cloths. So that was a great thing. So I would say the lip balm, the being able to brush your teeth, you know, because they can bring water in one of those little round things. You can brush your teeth in bed if you can't get out. But having that for yourself, just in case the hospital doesn't provide that. And then that's a comb. I did also have, well, I had a hair clip that I used the first time I went into the hospital, and I just kind of pulled up my hair and clipped it on top. But this last time I did bring headbands so that I could just at least pull my hair back and feel like it wasn't like going everywhere. I have some deodorant in here. I don't think I even used this at the hospital. Another thing of lip balm. This is kind of a pale pink, in case I wanted to use that. I don't think I did. My bag wasn't like right next to me, so I didn't really get to it. What are some other things in here? Just some wet ones and such. But another thing, the first time that I stayed in the hospital, I had brought my phone charger, and there was nowhere to plug it in. I mean, there was like over on the wall, but then I couldn't reach my phone. And so when it was charging, I couldn't get to it. And so the second time that I went into the hospital, I brought this. I don't know where the cord is. This is, you know, an external battery or whatever, and this is like 11,000 mAh, but I can completely charge my phone probably 3 times with this. So I had this completely charged before I went into the hospital, so that the first night that I was there, I put this, this that's my charger, a full charger on it, but so I could just plug in my phone to this and charge it with it just laying right there, you know, on that table that's right next to you. But I think if new hospitals, or if somebody's planning, like designing brand new hospital beds, that is an absolute must, that they should have a charger hooked into the bed or on that table that's right next to you that kind of rolls back and forth. At least have a USB port, or, you know, or an actual outlet on those, because they have power on them. The bed, you know, it has all the power stuff. So there's no reason why they couldn't have a phone charger on there. For me, if I was going to design a hospital, all the beds would have a phone charger, and they would offer complimentary pedicures. Because what would feel better when you're laying there in bed and you feel horrible and you're in pain? Wouldn't it be wonderful if somebody came around and rubbed your feet with lotion and did your toes? That would be heaven. So I suggested it to the nurse, and she laughed and just shook her head like, whatever. But so that would be my suggestion if I was going to redo a hospital. And there probably are some hospitals, like private type hospitals, where you get treated really nice. And the hospital around here, We have 2 in our area, and they're both wonderful hospitals, but they're just regular hospitals. So those were the things that I felt were essentials. You don't need to bring a big, huge bag. I mean, books. I did bring a book that's not in here. But honestly, I don't know, when I'm in the hospital these last 2 times, maybe it's the pain, the medication, just the whole everything. I was only there like for 2 days, but 1 night. I didn't feel like watching TV. I did read a little bit. I ended up watching videos on my phone. Was about the only thing that I actually felt like doing other than sleeping. That first day, all I wanted to do was sleep. I didn't want anybody to visit me or try to talk to me. I couldn't even carry on a conversation. But then the next day, after I'd had some sleep, then I was fine with having company, and then they get you up and out of the bed and stuff like that. So anyway, that's it for my essentials. I just really appreciated knowing about the eye mask, the earplugs, the having lip balm, because that was one thing they didn't offer me in the hospital. They did offer me like shampoo and lotion and I think some kind of a face wash and stuff like that just kind of came. The nurse offered me if I wanted it. And some deodorant, I think, and stuff like that. But anyway, having those things, and then the charger for my phone, and having my own comb and my own mirror, those were definitely essentials. And this little pillow, that was definitely an essential. I actually, I really enjoyed having that. And so, yeah, so that's it for my essentials. So, if you're interested in the surgeries that I had, the last spring I had a hysterectomy. I had fibroid tumors, and I'd had them for several years, and they just kept getting bigger and bigger. And my doctor said, don't worry about them until they start to bother you. So they started causing me to have really heavy periods, and so I decided, yeah, let's get rid of them. And I didn't realize how much weight they were causing and how the discomfort that I was having because of that. So it was, I would say it was the best thing that I ever did, having a hysterectomy. It was a robotic, laparoscopic hysterectomy. So I ended up with just little tiny incisions, like 3 on the top of my abdomen, and then 1 or 2 down low, and that was it. And I was surprised at that I healed really quickly, and everything was great with that, and I was really happy with it. And then in October, I went to just my regular primary care doctor and had a blood workup, like a once a year blood workup thing. And then she said, there's something going on with your kidneys. And she said, I want you to go in immediately and have an ultrasound done. And my blood pressure was elevated too. So I went in for that. And they immediately sent me to a urologist, and he said, it appears that your ureter on the right side is being constricted somehow. He said, I don't think it's a kidney stone. It's probably scar tissue. He asked me if I had any surgeries lately, and so I told him about the hysterectomy, and he said, yeah, when your bladder, your all that kind of stuff, they don't like being touched and messed with, and they probably got, especially my fibroids were really big. So he said everything in there probably got beat up pretty hard. And so he said, I'm thinking scar tissue has grown and is pressing on that ureter. He said, I'm just going to go in through your bladder, put a stent in the ureter, maybe, use like one of those bubble things and open it up. And he said, well, get things flowing again. Well, I did that procedure and woke up, and he said, I wasn't able to get in there. He said, by that time, my kidney, because my kidney couldn't drain, my kidney was engorged with urine. And so he said, I'm going to send you to a radiologist. He's going to put in a nephrostomy tube, drain your kidney, then he will go in through the kidney and go down into the ureter and place a stent there. And then, then we'll go back in and we'll figure out, hopefully that'll open it up and it'll all be fine. So I went in for like a short stay visit to the hospital. They put me out, and I woke up with a nephrostomy bag. I had this tube coming out of my back and draining down into a bag. And the physician's assistant came in and said that he just wasn't able. He got, he took the tube, goes all the way down into my ureter, and but he said he couldn't get through the ureter. He said whatever it is that's constricting it is just too hard, and so they can't get through there. And I tell you, I was so upset, and I couldn't believe how bad that hurt. The PA kept saying, there should be no pain. There should be absolutely no pain. The nurse kept saying, I don't know why this is hurting so bad. There shouldn't be any pain. And they made me an appointment to see the urologist 2 weeks later. But I think as soon as I got home, I called the Urology Institute and I said, I want to come in as soon as possible because I have to know what the plan is. I was not planning to come home with a nephrostomy bag. I had never even heard of that. It was very painful. It was very painful that whole first week until it healed. They didn't teach me I couldn't even see it. And so I couldn't change out. You have to change the dressing around the tube. You have to be very careful not to pull on the tube, yank the tube. It was really long, so it would come, I had to tuck it into my pants. And so my husband and I had to go back in, and they taught him how to change the dressing, and you had to completely cover it in order to take a shower. It was just... I was really feeling sorry for myself because I kept thinking I was fine. I was perfectly fine. I had no symptoms at all. It's good that they caught this, but at that moment in time, I was just really upset and feeling very sorry for myself. So I went back in and saw the urologist, and he said, okay, here's the plan. The only way to get to this is just to go in for surgery, and we're just going to have to cut you open in your abdomen and open it up. And he said, clip off the ureter where it's constricted and move it over and reattach it to the bladder. And then he said, you'll have a stent that goes from the bladder up to the kidney, holding everything open. And at the time, he said I would go home with a catheter and with the nephrostomy bag because they didn't want any kind of pressure on my bladder at all. And so I went in for the surgery, which went fine. And they took off the nephrostomy bag, but the tube was still inside me during that surgery. So then when I woke up, I just had the catheter. Which was fine. It was a Foley, like a balloon catheter. This time before, when I had my other surgery, I had a catheter that hurt very bad. I don't know what the difference between the two was. They had said that the other catheter had like a coil on it that was holding it in, and it was horribly painful, whereas this time the catheter didn't hurt at all. And I went home with that. The day after my surgery, when I was still in the hospital, they took me down, and the same radiologist took the nephrostomy tube out. And that did not hurt at all. I was so nervous about them taking the tube out because again, they kept saying it was being held in with a coil. But when he took it out, I guess there's like some kind of a string that they take out first, and it uncoils, and it was like this really thin little rubber tube. And then he just pulled the tube out. I was awake, and it was fine. Nothing hurt. If you can tell, I was very nervous about anything that might hurt. So going home, with the catheter, I just didn't want to go anywhere. It was kind of a sad first week. But then after that first week, I really, I was on the pain medication and all that. But then after that, I really tapered off on the pain medication. And as long as I was just kind of took things slow and I started doing a little bit more around the house and stuff. And I would just stop when I started feeling pain. And after 1 week, I went back in to the doctor and they took out the catheter. That didn't hurt at all. And so I was done. I had nothing. I told the nurse, it's so wonderful to not have something hanging off of me that's collecting urine. So that was good. That was wonderful. I felt like I'm finally, back a normal person again. And so that was a week, it was like a week and a half ago. And so today I went in for a follow-up visit and talked to the doctor, and he said that next week he's going to take the stent out. And so I'm just shocked at how well this week, especially, I went back to work, and I was really worried and kind of nervous about how I would do, because last week I went to a thrift store. One day I went to the grocery store, and then I went to a thrift store, and that was it. I was completely out of it. I mean, I was in so much pain. I just came home and slept. So I was worried about how much work I would be able to do this week. But this week I'm doing so much better, and I feel like I'm almost back to myself. I still, my incision is just right straight, on the bottom, my lower abdomen. And so I did wear just like some of my old pants, and it was kind of pressed a little too much on my pants, on my stomach. So I bought a couple pair of leggings. I don't normally wear leggings, but that's just what I've been wearing these, the last few weeks, ever since this started, since they put in that nephrostomy bag. So, I don't know. I'm glad that this was a temporary thing. I so feel for people who especially have a nephrostomy bag. If that was something that you'd have to have constant, it would really be challenging. And so I really feel for people who have those, and also a catheter. I mean, if you had to live with a catheter long term, that would be difficult in itself too. And so I've learned a lot from this, and I'm really glad that I'm healing. And if you have any questions for me, or if you're about to go through anything similar and want to know anything else, please, let me know. Reach out to me. I would love to answer anybody's questions. There are probably some things that I forgot to mention. And I really appreciate you watching my video. And thank you, and feel free to watch my other videos. Okay, bye.